Hello and welcome to the Dr. Celia Corbo Show. I'm your host, Dr. Celia Corbo, a functional health practitioner, licensed chiropractor, and entrepreneur. On our show, we feature and showcase wonderful entrepreneurs and learn about their stories to success. Today, I have Dr. Dolores Fernandez. Dr. Dolores Fernandez, ND MSCP, is a naturopathic doctor in Vaughan, Ontario, specializing in menopause. She is a NAMS Certified Menopause Practitioner and a member of the International Society for the Study of Women's Sexual Health with training in pelvic floor physiotherapy. Besides her clinical work, Dr. Dolores is a wife, mom, reader, fitness enthusiast, and the founder of Iris. This brand offers clean, science-backed vulva care products aiming to end the stigma around women's health. Through Iris, Dr. Dolores promotes education and support for women's health issues and smashing stigmas one vulva at a time. I hope you enjoy the show. Hello, Dr. Dolores, and welcome to the Dr. Celia Show. How are you?
I'm good. I'm excited to be here and chat.
Yeah, thank you so much for joining us today. I'm so excited to have you on as a guest because menopause is one of those subjects that I feel like there's a lot of mystery around. And it's one of those things that you don't really know what to do and you're just doing a lot of trial and error. So I'm really happy to have you on the show to give us a little bit more of an education and shed more light on the topic.
Yeah, it's definitely hard, especially with social media these days, I find. So there's just like so much out there. I find my patients are just more lost, even just like, what do I
Yeah.
believe? And so, yeah, definitely something we can dive into.
Yeah, I even get lost sometimes on social media and I'm in the health field and I'm like, oh my God, there's so much information. So, how did you even get into menopause and being that as your niche with helping your patients and clients?
So I always say like menopause found me. I wasn't planning on getting into menopause. To be honest, I didn't even have that much training in it. So I didn't really see it as an option to become my niche. I always thought I was going to be more in the fertility world. I
Hmm.
had done like more focus shifts and stuff in school. All my projects were very focused on reproduction. And then I started working and menopause was walking into my office. Like I'm trying to like advertise fertility, and what's walking in is like people going through menopause.
Hmm.
At the same time, my mom was going through menopause, so that was also like interesting because she's coming to me being like, what do I do, can you help me? And so I was trying to help her more than anything navigate this transition, both conventionally with her doctor. I was trying to get her within like functional doctors, naturopaths, like anybody who was willing to help or like felt they could help. And we were getting nowhere. And so I decided like I need to do this. Like I can't just rely on other people because
Yeah.
if you've ever seen somebody kind of transition through menopause, it could be, quite debilitating and it affects everybody. So that's kind of what I did. I found some mentors within the naturopathic field who were doing a lot of menopause work. I joined NAMS, which is the North American Menopause Society. When I joined, there was like very few naturopaths in all of North America that had this certification. So, and I did it more than anything to learn because I really didn't know. I might have had an hour lecture in school, and
Hmm.
but like
Yeah.
it's like menopause is a beast. It affects so much of a person's life. Like to just have an hour was really truly nothing if we were defining it basically. And yeah, so that's, and then like you start getting good at your practice and you get referrals, and now I'm at a point where I only see menopause and like pelvic health. So I'll see like vulvar conditions and stuff outside of menopause too. Um, but I kind of like close the doors at anything else because it's really hard to get good at everything. And so I just do all my extra training in menopause. I also teach and I'm part of like some continuing education programs where I teach about menopause and teaching about vulvar conditions. And so that's kind of just like become my life now.
That's amazing. And I would definitely agree with you that there are some subjects in school, I think all schools, where they only shed like maybe an hour or one class on a topic. And it's huge. It's like another entire beast itself, like you mentioned. So that's great that you took that initiative to learn more about it as opposed to just dropping and leaning on what you knew from school.
Yeah. And you know, it's like to no blame. Like I understand why.
No.
It's just we take that information and we go learn. But definitely leaving school, I was not prepared to be treating the menopausal person.
And when you were presented with your, I don't want to say your first case of menopause, but your first few cases when you started noticing that people were gravitating to you for this condition, what were some of the symptoms that people were coming to you to help with? Like, what are some of the commonalities that people with menopause present with?
hmm So I would, there's so many because it just affects like every piece of your life. But I think the more debilitating ones would be the hot flashes,
Hmm.
the poor sleep, like the broken sleep and just never getting restful sleep anymore, and the mood changes. Those would probably be my top three as far as like really affecting quality of life. But most people are also complaining about weight gain and body changes, hair growth, hair loss. So those are some of the bigger ones. But it's hard, right? Because someone comes in and they have like 50 things they're complaining about as a
Hmm.
practitioner. And I know you probably feel this way. It's like, where do you even start?
Yeah.
So it's like, what is affecting your quality of life the most? What could make the biggest impact if we work on that first?
Hmm.
So those would be like the bigger ones. And it's
Yeah.
just hard because everybody's menopause experience can be so different. And so you just kind of take what's in front of you and help them manage.
Yeah, exactly. And I think with a lot of subjects in school, it's presented very textbook. Like this is what happens physiologically and whatnot. But then everyone has a very different experience. And as a clinician, that's when you become a detective and you have to figure it all out, right? Because even with functional health, someone comes to you with diabetes and you're like, there's so much more happening here. And it's really debunking it, right?
And that's where I feel like the naturopaths plays such a great role
Hmm.
in this medicine because you know a lot of the guidelines I use are from the North American Menopause Society and those are the same guidelines that the OBGYNs are using. It's
Great.
just so let's say the guideline says something like we really value bone health, like
Hmm.
bone quality goes with age. There's nothing in that resource to give guidance to the practitioners of what to do. They just say
Hmm.
bones matter. So
Yeah.
your doctor might be like, hey, bones matter. But when you come see a naturopath and you have the time, we're like, okay, bones matter, but this is what we're going to do. And then I'm going to hold you accountable to that on like these lifestyle changes and stuff to really make a difference.
Yeah. For some of our younger listeners who have not yet experienced menopause, can you tell us what goes on in the body and why we experience these changes and even bone loss?
Yeah. So maybe good place to start would be like the different phases because that
Sure.
sometimes gets mixed up. So there's pre-menopause, like PRE.
Hmm.
Pre-menopause is people that are in a reproductive age. So that's probably like you and I.
Hmm.
Then
Okay.
there's perimenopause. They're not the same. That's like where a lot of people get confused. Perimenopause is the time leading up to your last menstrual period. And by definition, we want to be seeing a change in the period to kind of qualify someone as perimenopausal. And that
Hmm.
can just be like a missed period, it could be heavier cycles. We think that changes are happening in the body before the period even changes, but for now, we need some way to define it. So that's how we do it.
Okay.
Menopause is once you've gone one full year, 12 months with no period. It's literally one day. When you hit that anniversary, you hit menopause. And then for the rest of your life after, you are postmenopausal. So those are the
Okay.
different stages. And it's a fluctuation of hormonal changes that happen. It's not textbook, right? Like everybody wants
Yeah.
to imagine that it's just hormones dropping, 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 dropping to the point where you have none. And that is not what happens. There's
Hmm.
like high fluctuations of hormones, low fluctuations. There's those three menopausal stages. There's even stages within those to try to like guesstimate where the person is in their transition. But inevitably, at the end of it all, it is the loss of the ovarian hormones, which predominantly looks like estrogen and progesterone. We have a
Hmm.
loss of testosterone too, but that one is like a little bit slower. So most of the symptoms people are feeling are the loss of those two hormones.
Hmm.
And a lot of people don't know, like we have estrogen and progesterone receptors all over the body, including on the
Hmm.
bone, in the brain, in the walls of the vessels. So it affects your like cardiovascular health.
Oh, wow.
And so that's why you can really feel symptoms anywhere. Like people get tinnitus, like ringing in the ears, and have no idea how that's related to hormones, but you have estrogen receptors in the ear. So
Oh,
it could
goodness.
really everywhere, everywhere, everywhere. Yeah. So those loss of the hormones can really expedite um, certain diseases and stuff and just
Hmm.
aging.
Yeah. And it's to my understanding that estrogen is a very protective type of hormone. So it helps against so many things. One of the main ones that I've learned about was cardiovascular. Um, it helps with preventing heart attack, cholesterol deposit, high blood pressure, things like that. So when we are experiencing a drop in estrogen as we go through these different stages of menopause, are these things more likely to come on?
Definitely.
Yeah.
And there's even like a subgroup of people that may experience early menopause. So
Hmm.
even before 40, some people can
Oh,
experience it.
wow.
And so the risks of like all the heart stuff all go up, just like you would in somebody in their 50s, even though they might be in their 40s, because we
Hmm.
know estrogen is so protective for the brain, for the heart, for the colon, certain cancers, bone. It kind of shows up everywhere.
Yeah. And what has been one of your major successes with working with people with menopause?
Mhm. I really, really take the person that is in front of me, right? And so this is where I am proud to say that I really treat my patients individually. I don't ever blanket treat. So it really depends on the person. It really depends on
Mhm.
what they've been through, their age, what have they tried, what are their risks when they walk in? Like, am I already working with somebody who might have a lot of risk factors for cardiovascular disease? Are they on a lot of medication? So it really depends. But the gold standard, best thing that we have is hormone replacement. And I
Mhm.
know there's a little bit of still some stigma with that. A little bit of some research came out like 20 years ago that people are really stuck on and has been debunked. And there's been a lot of new stuff. But
Mhm.
it's one of these things that, again, like because I have the opportunity to talk and spend time with my patients, we can go through all the risks and like individual risk. I can tell you, like, what are your risks for
Mhm.
breast cancer using these things? That kind of conversation. So,
That's what I've heard with hormone replacement therapy, or HRT for short. There's an increased chance of cancer. Now, I don't know if that's a myth or not, but can you elaborate more on us with some of the myths that did come out and how they were debunked about hormone replacement therapy?
mhm. So I would say the breast cancer one is the biggest one. And
Okay.
there was a lot that came out of um, that study in 2002 that everybody's really stuck on. And so when we go back and we look at that study, there was just a lot of flaws in the study, and it was done on a group of people who we would never give hormone replacement to,
Hmm.
right? So they were all like seniors, like I think the average age was 70. Like we would never give hormone replacement to somebody who's 70 now.
Yeah.
And they were giving oral estrogen, and now we do creams, topical. They were using synthetic progesterone. Now we use like bio or body identical. And so it's hard to really get into the details of like why there was a lot of mistakes, but they stopped the study early basically because
Hmm.
they think there was an increased risk of breast cancer. And it's funny because they actually did the study to look at if hormone replacement was protective cardiovascularly, but then they stopped it early because of breast cancer. And when they actually sifted through the data, there were so many flaws. It just kind of ended up like a propaganda that like
Hmm.
hormone replacement causes breast cancer. They ended up finding that estrogen, when they gave estrogen alone, it actually had decreased rates of breast cancer.
Wow.
And that when they gave the estrogen plus the synthetic progesterone, we saw increased risk of breast cancer. So they think it might actually
Hmm.
had more to do with the progestin, like the
Yeah.
synthetic progesterone, which is interesting because estrogen is the one with the bad rep.
Yeah.
So and we don't even use progestin anymore. We use micronized progesterone, and so it's hard because we just like blanketed hormone replacement is bad. It causes breast cancer. Don't do it. But I always have this conversation with my patients, like, what is the risk if we don't do it? Like, let's talk a little bit about quality of life. Let's talk about your poor sleep. Let's talk about your mood changes. Let's talk about your bone health and like all the things, all the benefits that come from taking it, right? And
Mhm.
I'm not pushing hormone replacement on everyone. Definitely not. I just think that we have a lot of people have such a narrow, like they don't even want to talk about it. And I see my patients like really struggling. And I've had patients who started it and were like, oh my God, I wish I started this earlier. It's like saved my life. So I always just make sure people are informed about that. At the end of the day, it is totally your decision. I just want you to make an informed decision instead of just one that's based on things you've heard maybe from like your mom or your grandparents.
Yeah, exactly. And I think that because social media plays a huge role in everyone's life and there's so much information out there, it's so easy to just believe what the masses are saying. And then when you have someone that's turning it around and questioning, like, what do you think your life would be like if we actually did do this safely? And no one really thinks about that, to be honest, because as humans, our brain is wired to think about like the worst possible scenario. And I think that's what everyone just jumps to, especially when they're working with a practitioner. They're still skeptical.
Yeah, and I think like it's really nice for people to have that like relationship with their practitioner where they can
Yeah.
ask the vulnerable questions and so it's just teaching and debunking and making people feel really comfortable. But there is other options other than hormone replacement. I always bring it up for people just because I think people are already it's off the table unless they come in
Hmm.
wanting it. But then I will definitely do herbal things with people. There's a huge place for lifestyle and movement and diet and
Yep.
sleep and stress management and community and connection. Like those are really big pieces of my practice too. I always say like menopause is not just a prescription. It's not just like here's your hormones and we'll see you in a year. Like there's so much more that needs to be done here. So much
Hmm.
more conversation that needs to be had with just managing quality of life, right?
Yeah. Yeah. Lifestyle, even in my practice with chiropractic, with functional medicine, it's huge. It makes such a big difference when someone starts adopting these small, healthy changes along the way, because then your body just starts to heal and thrive. Because at the end of the day, our bodies want to be healthy. But if we're not giving the proper tools, then it's just going to stay stuck. And that's where practitioners come into place to help guide you through that journey. Right. So,
Mhm.
yeah.
And when
So,
people feel overwhelmed with like the options, like what do
yes.
I do?
Yeah. And you know what I tell my patients all the time? I'm like, everything that you hear about getting better sleep, eating healthy, going out and having social connections. These are all things that we already know. It's just we have to implement them. They're nothing's really new. It's just making the time and being consistent, right? So, yeah,
Totally.
no.
Like I
Yeah.
tell people most of my plans are boring. Like it's just being able to like be consistent with them, right? And like keep
Yeah.
showing up even on the hard days.
Yeah.
That is where the magic happens, not with a fancy supplement
E-
or
exactly. Yeah. So, what other things apart from hormone replacement therapy? We mentioned lifestyle, obviously, and all the things that we know with lifestyle, but what other things do you also tell your patients? Because I heard black cohosh is a really good supplement to help with menopause, but what is it for those of us viewers that don't know what that is?
so there's some herbs that are out there that they have almost like a hormone mimicking effect where they bind the
Ah.
receptor and
Mm-hmm.
they make your body think you have the hormone.
Mm-hmm.
Um, and so clinically, I will say that I definitely use them because patients who are not candidates for hormones or don't want them, that's where we'll go. And sometimes they work, sometimes they don't. And everybody's a little bit different. That's the reality of like when we're doing more like natural or herbal things. They just is a little bit more trial and error. They take a little bit longer to kick in. So sometimes we
Mm-hmm.
have to commit for 6 to 12 weeks before we even know if it's helping.
Mm-hmm.
The downside to the herbs, and this is more just like my personal practice, is I'm very evidence based. I like to try to follow the research. Like, what is the research saying? Or at least that's where I start. Like, what has the most research?
Yeah.
And so, and you know, it's to no fault. Like, we're not funding herbal research like we are drug research. So you
Yep.
can't always compare like head to head.
Yeah.
But there is some good research on some herbs, things like sage. Black cohosh is decent. There's
Mm-hmm.
rhubarb. There's red clover. Like there is a few herbs that have been researched for this. And clinically, like I definitely see it effective for people. It's it really so depends. And I'm honestly like I have no magic to say like you need black cohosh. Like
Hmm.
we really don't know. I would say personally, sage is the most researched, so I always start
Hmm.
there.
Yeah.
And that one's more research for hot flashes. But it's important for people to know that because we're kind of tricking the brain into thinking you have the hormone, you don't actually have the hormone. So you don't get all those benefits that we talk about with hormone replacement. You just get a
Hmm.
little bit of symptomatic relief, usually.
Yeah. Yeah, I think also just for viewers, this is not a diagnosis talk, it's just educational talk. But just a disclaimer. But also supplements need to be taken seriously. I find that because you can just find them at your grocery Walmart, your grocery store, natural food stores. People take them so liberally, and it's like, okay, no, you still need to get some kind of guidance or even testing, like analysis to see where your body's at. And I actually wanted to ask you, like, what kind of analysis do you do with your patients to see what would be the best course of treatment for them?
So in the world of menopause, everything, almost everything is very clinical. It's not
Hmm.
so because the hormones are changing so quickly that if we were to do any analysis, whether it was blood or urine, whatever we would capture would just be that day. So
Hmm.
I've had people bring me blood work, let's say, where we're looking at hormones and their hormone levels are like that of a 20-year-old, but they're coming in complaining of symptoms of an 80-year-old, right?
Wow.
And so it's literally just that moment in time. So for the most part, when we're talking like actual menopause symptoms, there really is no testing that's guiding us. It's very, very
Hmm.
clinical. But then all the other things that come with menopause, like the increased cholesterol and blood sugar and all that, I'm mostly running blood work. And
Hmm.
then I'm really holding my patients accountable to keeping up with their screening tests like mammograms, PAPs, bone density, colonoscopies, those big tests, just because
Hmm.
we know the risks are higher as people age. And so, you know, I want people getting those screening tests. Like we're so fortunate here in Canada to have them covered
Yeah.
that I really, really push people to utilize them.
As a naturopath, are you able to send for those more complex? Like, I know colonoscopy needs to be done with a gastroenterologist, but are you able to refer them to see one? And do you have more of a hand in all of those more specialized tests?
Not in
Yeah.
Ontario.
Yeah.
I could do a PAP, like we could do them ourselves, the PAP
Okay.
pelvic exam.
Yeah.
Um, Hopefully in the fall, they're opening up self signups for mammograms for anybody
Oh,
over 50. Sorry, over 40. They're going to be opening
yeah.
that up so people can book themselves. But then the bone density and the colonoscopy, no. I
Yeah.
have some of my patients who will go private and they'll
Hmm.
just get it done because some of the guidelines are a little bit questionable. Like
Yeah.
the bone density, like in Canada or in Ontario at least, it's not till 65, and that's
Wow.
yeah. So the
Oh my
people aren't getting their
goodness.
first
That's
one until
late.
65, and so when people have a family history or they're just a little bit more petite, or I feel like the risk factors are a little higher.
Yeah.
We try to talk about either getting them in for one or potentially going private.
Yeah, I think that's one of the things with allopathic medicine is that there are these set ages and it is very textbook, you could say, which I can appreciate. I know they're trying to control the delivery of all of these exams, but yeah, I definitely am in favor of like if you think it's an issue, like go get it checked out because a lot of these things don't happen just instantly. They're developing over time. And it's once you finally feel the symptoms that it's not too late, but it's harder to reverse it, I find.
Definitely, especially in the world of osteoporosis, right? Like if we
Yes.
can catch you while we have like bone thinning,
Hmm.
osteopenia, there's so much more we can do to support you than somebody who actually has the diagnosis of osteoporosis.
Yeah, absolutely. I see it in my clinic all the time, especially with my female patients. It's more common than we think. And it's I don't want to say it's scary because I don't want to instill fear in people, but we can prevent it from getting worse and from having it be this, awful diagnosis that people usually associate it with.
I even
Yeah,
find that sometimes just knowing pushes my patients to do more. So if they know
for
they have
sure.
osteopenia, they know they have bone thinning, they're more likely to really commit to the resistance training versus when I'm just saying, you should do it because it's good for your bones.
Yeah.
So I find that could be a powerful tool too.
Yeah. Yeah, absolutely. Once you know, everyone's favorite word is their name. So once they know what's going on, it changes the game entirely. Yeah.
Totally.
Yeah. Well, I want to talk about Iris with you because it's this amazing product that you developed to help your clients or to help women in general. So, can you tell us the background story about Iris?
Of course. So as I was kind of moving into this menopause, like I was saying, like getting busier and busier, a big symptom that comes up that a lot of patients don't talk about is vaginal dryness,
Mm.
and genitourinary changes like dryness, pain with intercourse or any penetration, increased risk of infections. Like there's a lot of genitourinary symptoms that happen and nobody talks about it. So I was finding that like my patients weren't coming in and bringing it up, but if I asked them, they were like, "Oh yeah, like yeah, that's definitely a thing."
Yeah.
Or I would find my patients were making lifestyle changes like, "Oh, I don't have sex anymore." Or because it hurts, and they were just making changes to their life to accommodate for the genitourinary changes without actually acknowledging the changes were there. Does that make sense?
Yeah. Yeah. They were basically just putting it under the rug,
Yes,
just
exactly.
banishing it. Yeah.
Exactly. And I was just kind of like, hey, like there's like so many things we could do. And so I kind of made it my mission to be the one that brings it up with my patients. And I was finding like almost everybody was experiencing
Mm.
changes and they did want the help once the conversation was open and that like they were vulnerable with me and we were able to like share this moment. And so I started working with a pharmacist to develop and just formulate a moisturizer. I would send her the ingredients and I'd say, "Can you like mix this up for me?" And my patient will come pick it up and whatever. And we were having like really good success together with this. Most of
Hmm.
my patients needed it. And so that was the moisturizer. And then additionally, I was often recommending a personal lubricant for anybody who needed it. And there really wasn't that many options that were in store. And this was like prime COVID time. And my patients were like, "I really don't want to order online. Like I share an Amazon account with my kids. Like
Oh, yeah.
yeah, but and I don't want it delivered to my house." And so I was like having a hard time finding stuff like in stores and like a drugstore for them that was
Mhm.
good quality because a lot of people don't know there's like a whole science behind lube and moisturizer. So like it wasn't good enough for my patients to just go pick up whatever was there. And
Yeah.
so after a couple months, my entrepreneurial brain was just kind of like, I should make this. Like I should look into like what it would take to formulate this. Like I'm formulating already. And so this was in like 2021, I want to say. I found a
Mhm.
manufacturer in Canada and I started working with their team to just basically be like, here's the science, here's what I want, here's what I need, let's work together. And that's when Iris was born. So we have two products. We have a vulvar vaginal moisturizer and a personal lubricant. And they're both
Nice.
like evidence based, following the science, just at least the most recent science. For it was really formulated with the menopausal person in mind because that's who my patients were and that's who I saw needed this. And
Mhm.
as we've been out and selling and meeting people, we realize like no, so many more people need this. Like young people need this, people who wear tampons need this, and people who breastfeed need this. And there was just so many other parts of people's lives where this fit in. So developed with the menopausal person in mind, but definitely good for anybody with a vulva.
Yeah, pretty much, yeah. Yeah, you actually answered one of my questions because I was going to ask, is this only for or predominantly for the menopausal woman? But you just said it's also for the younger population. So, what types of situations would we be seeing in a younger population where they could use this?
hmm So the moisturizer is literally exactly what it sounds like. It's a moisturizer like you would moisturize anywhere else on your body.
Okay.
And so there's certain times in people's life where vaginal dryness is a little bit more. So we know menopause and the loss of estrogen is one big one. And
Hmm.
the reason I say that's a big one is because if it's there, it's there forever now,
Right.
unless you do hormone replacement.
Okay.
But then postpartum, and if somebody's breastfeeding, that is also a low estrogen state. So it's
Hmm.
almost mimicking what it would be like to be in menopause with a
Oh,
different
wow.
cause. And also, when you stop breastfeeding, your hormones are going to come back. So this is
Right.
more like of a temporary thing. I
Yeah.
think when people think of menopause, we think like 50 plus.
Yeah.
And kind of like I mentioned before, there's people who experience premature ovarian failure or insufficiency where they go through menopause in their 20s. They're
Mm-hmm.
experiencing it. Anybody who's gone through like any chemo or radiation for something hormonal, like breast cancer, may experience it. Like, and
Mm-hmm.
then this is just dryness, right? And so
Right.
when I think of the moisturizer, I think of like daily moisture, somebody who just like experienced discomfort, like
Yeah.
daily, maybe they can't wear jeans anymore, like those kind of things.
Mm-hmm.
Some people with that wear pads, the pad could actually be pretty like moisture draining, just because that's
Mm-hmm.
its job is to pull moisture, but then it can pull your moisture too.
I never thought of that.
Hmm.
'Cause I stopped wearing pads and tampons like a little while ago, and I do the Diva Cup now,
Yeah.
and I never put two and two together that it pulls moisture. I just thought it just collects my blood.
No, it's totally. And then like I have patients who have like urinary incontinence, so they're wearing a pad for that, and it's doing the same thing, or it's just like
Oh my
chaking.
goodness.
Yeah, so there's a lot
Yeah.
of reasons why someone might experience dryness. Um, so that's more like the moisturizer daily, like you would moisturize your face. The lubricant
Mhm.
is used anytime there's increased friction. And so I think the
Mhm.
first thing everybody thinks about is like any type of like penetrative sex,
Yeah.
which is it's used for that, but we definitely have people who use it for pelvic floor physiotherapy. So when
Right.
you're using dilators and those kind of like home techniques and stuff you got to do, they usually want to be using a water-based lubricant.
Mhm.
We have some patients who use it for tampon insertion just to make it a little bit easier,
Wow.
right? So and
Wow.
so young people could be using it, and then I just have the young people who are like, I just want to have some fun. So it's not
Yeah.
that they're necessarily experiencing dryness; they just want something to change it up. So it can be used in a lot of different ways for that, like for those things. I
Mhm.
think it's important people know they're different because they're not the
Yeah.
same product. They're not formulated the same. And that's why I always say the moisturizer is exactly what it sounds like. It's something like daily moisture.
Yeah. I have two questions for you. The first one is a little off topic from Iris, but do you recommend pads and tampons to your patients, or do you recommend something else, just considering how it's moisture depleting and things like that?
So depending on what we're using it for, so like I have some patients who have like severe vaginismus, which is like tightening of the pelvic floor muscles, that
Mhm.
using something like a Diva cup is extremely painful and inserting
Right.
it is almost impossible. So in
Right.
that case, I prefer obviously a pad, but we're trying to pick better quality. We don't want stuff that's
Yeah.
been bleached and like a lot of chemicals in there. So we'll pick a better quality pad. It really depends on the person, honestly. Like
Mhm.
I use the cup, and I love it for a lot of
Yeah.
reasons. But then, yeah, like I have some patients who have like burning and skin irritation. They prefer the
Mhm.
cup. It
Yeah, it
kind
just
of depends.
depends. Yeah, because every time I tell someone I use the cup when we're in girl talk, like, "Oh my god, you do?" And I'm like, "I love it. I've been using it since 2014. Like, it's the best thing ever."
I totally agree.
Yeah. Yeah, no, I love it. No, because I've heard a lot, like, I was using tampons and pads back in the day, but I heard about the bleach, the chemicals, and I'm just like, "Oh my gosh, that's such a sensitive area." In putting all of those chemicals right in this system that is already, I don't want to say it's a mystery, but there's so much happening down there that who knows what can affect it long term. So
Mhm.
that to me was just like a huge wake up call. Like, hey, I'm not using any of that. But like you said, it is just dependent on the person, right? And there
And
are some natural alternatives.
yeah, and I'm so grateful for those because even
Yeah.
sometimes patients with like endometriosis, really painful periods, I notice a
Yeah.
difference just changing them to a different pad, like different
Hmm.
brand. So
Wow.
like
That's
completely
huge.
telling of what's happening with absorption of stuff like the dioxins and
Yeah.
stuff. Yeah.
That's amazing. And then my second question was, can you talk about the science behind lubes and these creams and why? I know you decided to make your own because of, the science and the naturality of it, but tell us a little bit more about what we are getting on the shelf compared to what we would be getting with Iris.
So I'll do one at a time. Let's start with the
Yeah, sure.
lube, just because I feel like the lube, like a lot of people understand lube a little bit more.
Yeah.
So with lube, there's different types. There's water-based, silicone, oil. and some are better than others depending on what you're using it for. We chose to go water-based. Water-based is the most similar to people's natural production of lubrication. So that's the one we went with. The downside of water-based is that it requires preservatives. We have to put something in to preserve it or it can go rancid. Whereas something like oil, like let's use olive oil as an example, it's just olive oil. So it's just one ingredient. They don't need preservatives. So we needed to pick a preservative. A lot of those preservatives can be very irritating for vaginal microbiome. So things like glycerin, glycols, parabens, those things, those are all preservatives that are used to help preserve it. And like I said, we need to have one. It's just we picked one that was less likely to cause irritation. So that was one big one. Another thing is fragrances and flavors. There's a lot of fragrances and flavors, which again can be really irritating. Also increased risk of infections like BB and yeast infections and stuff. There is pH. That's another big one, right? So we want the vagina has a pH of around 4.5. And as people transition through menopause, the pH changes and goes higher because of the loss of the hormones, which already brings you more prone to infection and irritation. But then if we have a lube that is also a high pH, like a 9, in somebody who's already a 6, like they're already not optimal, we're really pushing them to like the basic alkaline side. And again, increased risk of irritation, discomfort, infections.
Yeah.
And then the last piece is osmolarity, which I'm always a little hesitant to get into. It's a little bit like higher level, but it's basically the movement of water through your body and a product you're putting on your body. And if you have a product that has really high osmolarity, it'll actually start pulling water from your body into the product to try to create homeostasis. And so in the long run, a product like that will cause more dryness. So we're using a lube for somebody who has dryness, and then in the long run, it's actually making the dryness worse. So we wanted to do like an ideal osmolarity, an ideal pH with as little irritants and preservatives as we could. And so that's the beauty behind the lube. And I tell people, you know, our bodies are a little bit more resilient when we're younger because of these things, like a pH that's optimal, hopefully. But when somebody transitions through menopause, those little changes can make a big difference. And so using something off the shelf that maybe they chose glycerin because it's cheaper and it's a cheaper preservative, that might irritate you. Like that might not be great for you anymore, even though it might have been okay 10 years ago. Right.
Yeah.
So that's like, those are the big ones in the lube. And for the moisturizer, like my thing is that there really isn't that much researched for vaginal dryness. So is shea butter harmful? Probably not, but we don't have any evidence to say that it works, right? So with our products, we put hyaluronic acid and vitamin E in there because those are two things who have been researched, but also put up against estrogen and like vaginal estrogen. And it was almost as good as for symptomatic relief. It was almost as good. So we really wanted to develop something that had research behind it to say like, hey, like this should be used. And I never want to like knock some of the other things that are in other products. Those things like we just don't know, right? And so I tell people if it works for you, that's what works for you. I'm an evidence-based practitioner, and so that's how I formulated the product.
And the cream, is it solely external use and the lube internal use?
So for the moisturizer, it's internal. The research on hyaluronic acid and vitamin E are both internal and external.
Okay.
And then the lube, we just say, you know, use as needed.
Yeah.
Yeah. And another thing I like to actually mention too that I always forget is that the moisturizer, I formulated it in a gel as opposed to a cream. And I only remember it because always when people open it, they're looking at it and they're saying like it's not cream. No, it's not cream because creams are very irritating on mucous membranes. They usually have a little bit more alcohol in them. So in skin that's already dry and irritated, that would be really irritating. So I formulated it in a gel.
Oh my goodness, this sounds amazing. I can't wait to get my hands on it and try it. Honestly, it sounds so cool.
You know what? It's one of these things that I I'm really proud of the products, but I was really involved with formulating because I had the clinical experience. So even when we like spoke with the manufacturer, like they're just making things. They're not sitting in front of
Yeah.
the person and really getting the feedback. And because I
Hmm.
had been working with people for so long with this, I knew, like I knew even down to our packaging was so intentional because like I know how these people feel having to use a vaginal moisturizer or having to use a lube. So I was like, I want it to be beautiful. I want the packaging to be like something you're proud to be using and not feeling like you
Yeah.
have to like hide it at the bottom drawer.
Yeah. Why do you think there is such a stigma around women's health and, you know, having a healthy vagina and vulva? Like, why do you think, based off of your practice, that this exists?
It's a good question. I really wonder.
Mhm.
I think we don't value it as like a piece of medicine, right? Like I feel like
Yeah.
sexual medicine as a whole is almost seen as like bonus, if you want to call it. Like
Yeah.
it's not medicine, right? And so like some of these societies that I'm involved with are like very focused and being like, no, this is a big part of people's health and people's mental health and well-being and
Yeah.
relationships. And so they're definitely making a big movement, but I think that like when you look at the stats, like with genitourinary syndrome of menopause, so like that dryness and everything I was talking about, it's like 11% of practitioners bring it up with their patients, even though they know
Wow.
it's a concern. Yeah. And it's like, and so it's already such a hard thing for patients to talk about, but then your doctors don't bring it up. So you're kind of like left in this,
We
like,
don't talk about it.
you don't know how to talk about it. You don't know how to bring it up. And so like we always joke that like we're the topic of conversation in the group chat because sometimes you can just rely on your friends a little more for these
Yeah.
things. Um, I think that sexual medicine, and I think this is seen as sexual medicine, even though it's so much more.
Yeah.
Like when we're talking about pelvic floor physiotherapy, like that is so much more than just sexual medicine.
Yeah.
So I think it's doing better, but yeah, we definitely are not doing a great job in the medical world with prioritizing this.
Yeah. I think it's been just a part of the body that so many people see as, I don't like to use this word, but shameful to talk about. And they hide it. They don't want to be seen as having a problem. What's wrong with me? And so they just keep it to themselves, thinking that it's normal. And in reality, it is, if we're going to speak science and doctor, it is just another part of the body that we need to bring attention, especially with the rising rates of breast cancer, ovarian cancer, cervical cancer. Like, we need to pay attention to these areas, right? Because they're so important. They could be life threatening if we don't.
Even with like I'll often ask my patients, let's say somebody comes in for a vulvar concern, and I will say, like, does the skin look different? And they're like,
Hmm.
I don't know. I'm like, you didn't look at it? No. Did you look at it before? No. So I'll tell
It's
people
not
like
even
it's so,
looking.
yeah, like I'm like it's so
Yeah.
important to look at your skin just like everywhere else because now we don't know if there's been an evolution. Has the skin changed? Has it become how do we have plaques? Has this thing always been here? Like we don't know, right? And I always say, you fall and bang your knee. What's the first thing you do? You look at your knee.
Yeah. It's
And so
true.
now people experience pain or discomfort and they wait for me to do the exam, which is okay. And I'm happy to do it, but I don't know the evolution,
Hmm.
of the skin. And so
Exactly.
I think now I've caught three vulvar cancers where
Wow.
it was itching and dryness and things that sound very menopause. And so when I
Yeah.
did the exam, I said, no, this is something more and we need to get it looked
Oh my
at. Right.
goodness.
So
Wow. And I think even just looking and knowing your body, it is such a stepping stone towards more female empowerment and to being in your feminine self as opposed to banishing it and putting it to the side. Because then you can catch things like these that, like we mentioned, life altering, life threatening. Yeah.
definitely.
Wow. Wow. Now, what is the regular pH of the vagina and even the cervix? Like, what should we be looking for in regards to making sure it's healthy?
So 4.5 is ideal. So like anywhere between
Okay.
4 and 5 is what we're going for.
Okay.
Which is why the pH of Iris is 4.5 because we want to keep as like optimal as possible.
Hmm.
Um, and like people could literally buy pH strips. I get my patients to buy pH strips and just check themselves
Yeah. Okay.
because
So
and
it's
it
not a
doesn't.
year. It's not like
Sorry,
a urine sample. It's they insert it or they rub it onto the area.
yeah.
Okay.
Yeah. So you
Okay.
actually would want to be checking like the discharge
Okay.
because the pH of urine is very different and it's high.
Yeah.
So
Yeah.
yeah, no, we would want those checked. And like the more informed people are, the better they can advocate for themselves too, right?
Yeah.
So sometimes like even my younger patients, if they're not in menopause, they might do a pH strip because they have other symptoms and it's
Mm-hmm.
an 8. And I'm like, an 8
Hmm.
is not optimal. So let's go chat with your doctor to get some swabs and whatever done. And
Yeah.
again, like we can just advocate better because we have more data.
Yeah. Yeah. How about like body washes? I've heard that we shouldn't be using body wash down there because it does alter the pH as well. So can you shed a little bit more light on that?
So most of them are very harsh.
Mm-hmm.
They also like soap requires a surfactant to kind of like if you imagine you have oil on your hands, like you really need something special, some type of chemical to get the oil off. Water won't be enough. And
Mm-hmm.
those are really harsh for like vaginal tissue, which is mucous membranes. It's not just like the same type of skin on your arms and legs. And so it is self-cleaning in the sense that like you really don't need any soap. You need water. You don't need any. But I do tell people if you're going to use a soap, use something that is pH balanced. And again, you would want something to be in that 4.5. We don't want fragrance. We don't want flavors. We don't need any of that.
Yeah.
Um,
It
it's
smells
like
fine.
yes, like you're supposed to just smell the way you smell. There's
Yeah.
certain smells that are not good, like if
No.
we're smelling yeasty smells or fishy smells, like let's get those checked out. But you're not supposed to smell like tropical beach. It's just not. That's not natural.
Maybe Iris can come out with a body wash.
Maybe, and you know what's so funny
Maybe.
is like a lot of people ask me for it, and I'm so on the fence because I'm just like, I don't think everybody needs it. So I wouldn't
Yeah.
want to like direct people to thinking they need a wash.
Yeah.
Um, so I'm kind of
On the fence about it.
yeah, so that
Yeah.
those are the conversations I like to have with the person in front of me and being like, let me give you
Yeah.
my recommendation because I know you now.
Yeah. And would Iris, as both the lubricant and the moisturizer, be contraindicated for anyone? Like if there is a yeast infection, if they do have anything that, would generate some kind of discomfort or irritation?
It's a good question. I usually tell people if you're fighting an infection like BV or yeast, don't put anything except for whatever
Hmm.
we're doing to actually treat it.
Hmm.
Um, so I would say that would probably be the only one. Otherwise, it's like totally safe unless you're allergic to anything in the ingredients. Like aloe is one of our ingredients. So unless
Hmm.
you have a personal allergy to anything, it's not contraindicated in anybody. And I
Yeah.
like to also mention the moisturizer can be used alongside hormone replacement. So I have some people
Oh,
who are using vaginal hormones for these symptoms because maybe the moisturizer is just not enough and
hmm.
you can only use your hormones twice a week. And so they use the moisturizer alongside.
Oh,
Like on
that's
the days when they're
fantastic.
not using hormone, they're using moisturizer.
Yeah. Oh, that's great because yeah, a lot of people become very lost, I guess you can say, when they don't know what other alternatives to use or they feel like there's such a limitation to a certain medication or supplement. So that's great
Hmm.
that that's also an alternative as well.
Hmm.
Yeah. Oh, awesome. Now, can we dive a little bit into the entrepreneurial side of
Of
Iris?
course.
Because being an entrepreneur, I love finding out more about people's businesses and their journey towards how they got to be so successful, especially with you with Iris. But can you tell us about the journey of the product and how it came to be and how long it took?
Yeah. It has been a journey, right? And even just like being female
Yeah.
in an industry where like somehow everybody I could talk to and connect with end up being male. Um, and then running a clinic or like running a private practice and then having a daughter and a family life, like it's busy. It's busy. I love it. I would not want it any other
Yeah.
way, but it's definitely busy and people don't always see that behind the scenes.
Yeah.
I would say like we started formulating in 2021. And there was like, I had no idea what we were in for as far as formulating because it was also like prime COVID time. So it was back and forth with the manufacturer. They're in Quebec. I'm in Ontario. So, sending things back and forth.
Hmm.
What ingredients were on back order because of COVID. I don't know. Do you remember when there was like all those shortages of everything?
Yes.
There was a point where they were trying to really convince me to use a different preservative just because they couldn't get a hold of the one I
Ah.
wanted.
Yeah.
And it ended up delaying us by almost 6 months just because
Oh, wow.
I really didn't want to just cave and use what was cheaper. I was
Yeah.
like, I want to, like, this product needs to have integrity. And
Yeah.
it was so like, that was the whole point of the product and the line, was that we were going to be
Yeah.
different. So it was a lot of waiting. And then we got a test batch and they sent the wrong stuff. Like, I see all the ingredients and I'm like, I said no glycerin. I said no this, no that. Send it back. Send me new samples. Then I had 10 menopausal patients, so 20 in total, 10 for each, test the product for me, get some
Hmm.
feedback on like what they thought and did they love it and all that. And then production took, I think, like, we didn't actually get the product till 2023, in July of
Wow.
2023, yeah, from 2021.
Oh my
And
goodness.
yeah, it was so much back and forth. And then, so my husband is actually in marketing. So he's our like visionary behind like how pretty it
God bless.
is.
That's amazing. That's like
Yeah,
half a
it's really
battle over
nice to
there.
have, yes, him in-house. So like our website and all that, like design wise, we were covered, because like that's a lot too, like even just
Yeah.
money, like money spent.
Yeah.
Um, so he had been doing all that behind the scenes. And then 2023, we started sales, August 2023. So we're almost hitting the 1 year mark.
Oh, wow. That's so
Yeah.
exciting.
Yeah, it is really exciting. It's been a journey, being an entrepreneur. Like, everybody sees the highs, and when the highs are high, they're so high. Like, you are on
Yeah.
top of the world,
Yeah.
but those lows are really lonely. And I
Yes.
think that people have no idea how scary that could be, of like, sitting on all this inventory, or just like even before it came, the like imposter syndrome of like, oh my God, are people going to like this?
Yeah.
Are like, is this as good as I hope it is? And all the thoughts, right? And so
Yeah.
I've been really, really, really fortunate to be surrounded actually by a lot of entrepreneurs. Unfortunately, nobody in the product-based business, so most people are more service-based.
It's a hard
Um,
business to tap into. Like you said, lots of product, lots of overhead, lots of money goes into that. Yeah.
and then you're like sitting on this stock, like, is it going to
What do I
sell?
do?
Like, I don't even know. Like, you're trying to get yourself out there. And so hitting our first year, like, we've done really good. We have our first employee, on top of like me and my husband. And so that's been fun. And it's just been a journey. It's kind of one of these things that you like take it as it comes.
Yeah.
You don't even know what to expect because you don't know what you don't know.
Mhm. Yeah.
And like, like our first hire, I remember she was just like, so what exactly is my role? And I was like, you're literally doing everything, because I'm one and you're two. So like, you're going to be doing a little bit of sales, a little bit of this, like, because that's the reality of a startup, right? And
It is.
people don't know that. Is just like, you're figuring it out until you're
Yeah.
big enough to hire somebody for every
More.
role.
Exactly. And that's exactly why I wanted to put this show on, because being an entrepreneur, like you said, it's high when it's high and it's low when it's low. And people don't see the lows because it's not on social media. And if it is, it's like, stop feeling sorry for yourself or pick yourself back up. And there's this almost like this harshness when it comes to wallowing in your own defeat, but I wouldn't call it defeat, maybe like a learning opportunity. And entrepreneurship is hard. It's really difficult. And yeah,
It's
it needs
so
to be
hard.
embraced.
Totally. And like, for me, I would say people often say to me, like, how are you doing all this? Like, as
Yeah.
you know, I'm like super pregnant right now. I have a 2 year
Yes.
old. I'm running a clinic. I'm running Iris. And people say to me, like, how are you doing it all? Honestly, I have an incredible support system,
Yeah.
who, like, my husband is amazing. My parents, my in-laws, like, I have so many people that are involved in helping,
Yeah.
that like I couldn't do it without them. And I think it's so important to share that, because I don't want people to look at me and think I'm doing it all. I am no
Yeah.
superwoman, I promise.
It takes a team. It's a village for sure.
It
Yeah.
really, really does. And
Yeah.
I think, me personally, I think that entrepreneurs, I think we're born kind of with leadership in us.
Yeah.
And so like, from before, I always knew that like these things were important to me. I've always been a go-getter. And so I remember when I was pregnant with my first, like, having these conversations with my family and my friends and my husband, and just being like, listen, this baby's gonna come, and I'm so excited to be a mom, but there's other things in my life that I really value that I
Yeah.
don't want to lose.
I'm in the same boat because my husband and I are talking about getting pregnant and starting a family. But being an entrepreneur and spending so much time before being a mom and doing all of this, you don't want to lose that, but you know you're going to need more support because it's not that cushy salary 9 to 5. It's like 24/7, all hours of the day. It's intense. It can get intense.
Totally.
Yeah.
And it's doable. It's totally doable if
Doable
you
for
set
sure.
yourself up. You just like, you
Yes.
can't just, because you'll burn out and you will just
Yeah.
lose motivation if you just try pushing through. Set yourself up and it can totally be done. And I was always like, I've always been fortunate enough to have people in my life who have always pushed me to be like, you do the life you want.
Yes.
Whatever that means. I wasn't pushed into the like, you need to be a stay at home mom or the 9 to 5. It was just kind of like, as long as you figure out how you're going to make it work, you can make it work.
Yeah. I think at the end of the day, the ultimate frequency to hit with anything, including being an entrepreneur, is just love. You just have to love what you're doing so much that everything else, it's just so easy because there's such a passion for it and there's such a desire to make change in the world, especially with Iris. Like it's really about that, I think.
Because after a
Yeah,
while, it stops feeling like work, like the
absolutely.
conversations are just the best.
Yeah.
Like I always say, I have the best job. I get to like do exactly what I want to do every single day, even though there's hard days.
Yeah. Did you know that when you were going through naturopathic school and when you were entering into this world of being an adult and having a career, that entrepreneurship was something that was always on the table, or was it something that fell into your lap?
Always, always.
Yeah.
I was the kid that was like, I had a lemonade stand. I was the kid that was like, I've always been like even my dad says it, like as a kid, you were always a leader. You were always telling people what to do. Um, yeah, I think I knew even like from when
Yeah.
I finished school, it was always either like, I got to open my own clinic because I know that's the life I
Same.
want to live,
Yep.
or I'm going to do something else because when I have a vision of like how my life is going to look, being an entrepreneur has always been a part of me.
Yeah, I would agree. After school, I was like, I can't work for other people. Like that's not the life that I did, but it just wasn't my end goal, you could say. I knew there
Mhm,
was more to it.
mhm. And I
Yeah.
like for me, I always learn that people who are entrepreneurs, like we often have those like 5, 10 year goals, and you gotta have those goals because or else how are you going to get to them if you don't know what you
Exactly.
want? How are you going to set up
Exactly.
and plan to get there?
Yeah, it's all about having that. I don't want to call it the end destination, but that level up moment. You're like, okay, I've reached this. What's the next thing that I'm going to do? Because as an entrepreneur, you're never done, but you're just on the quest to better yourself and create a better environment for you and everyone that's in your circle.
Hmm. Totally
Yeah,
agree.
amazing. Well, Dolores, where can we find you on socials? Because I would love to follow along and I'm sure my viewers would like to as well.
So my personal one, which I'm not the greatest at posting at these days, been busy, is Dr. Dolores ND.
Mhm.
And then for Iris, it's lovemy.iris on Instagram.
Amazing.
I'm pretty much only on Instagram these days.
Same.
It's one of those things that it's hard to keep up with
Yeah.
everything.
It's like having another job being on social media. It's crazy. Yeah, there's a lot going on. Yeah. Oh, well, thank
And
you. Yeah.
before we end off, I did want to share a discount code with your listeners if they are
Yes.
interested in purchasing any products from Iris. The discount code, and I'm sure you'll write it somewhere, but will
Yeah.
be DRCC15.
Perfect. I'm going to put that in the comments. And then every time we're posting this on socials, I'm going to make sure that that code's in there.
Okay, perfect.
Amazing. Thank you so much for being on the show today. And thank you all for listening in. Don't forget to like and subscribe so we can keep making you awesome videos. And we'll see you at the next one. All right. Let's just get that.